The distinction between medical information and medical advice is crucial, but often blurred in AI contexts, creating confusion and potential harm. Understanding this difference is essential for appropriate AI design and use. Medical information educates about health topics generally, explaining what conditions are, how they're typically diagnosed and treated, what symptoms might indicate various problems. Information is general and educational. Medical advice recommends specific actions tailored to an individual's unique situation, telling you what you personally should do about your symptoms, whether you specifically should take a medication, what treatment option is best for your particular circumstances. Advice is individualized and actionable. AI is generally better at providing information than advice, but interfaces often blur this distinction. A user asks, "Should I go to the emergency room for this chest pain?" They're asking for advice, a recommendation about what they personally should do. AI might respond by providing information about what chest pain can indicate and when emergency evaluation is generally recommended, but it cannot truly assess their individual situation without physical examination and often without diagnostic tests. The response might be phrased as advice. You should seek emergency evaluation when it's actually conditional information. Chest pain can indicate serious conditions that require emergency evaluation. The user may not perceive this distinction. The legal and ethical implications are significant. Licensed medical professionals are legally authorized and required to provide medical advice. They're trained to gather relevant information, perform examinations, interpret findings, and make individualized recommendations. They're accountable through licensure, malpractice insurance, and professional oversight. AI has none of these attributes. It's not licensed, not trained in the comprehensive way physicians are, cannot gather physical examination data, and has limited accountability through current legal structures. When AI crosses from information into advice, it's arguably engaging in unlicensed medical practice. Preventing misuse requires careful interface design. Outputs should be clearly labeled as information, not advice. When explaining what symptoms might indicate and when evaluation is generally needed, AI should explicitly state that this is general information and that only a healthcare provider who examines the individual can provide specific medical advice. Uncertainty should be prominent. Instead of "you should do X," language should be based on general medical information. X is commonly recommended for these symptoms, but only a healthcare provider who examines you can determine what's appropriate for your specific situation. For any action-oriented statements, there should be requirements for clinician confirmation or escalation to human triage. If someone's query seems to require medical advice rather than just information, the system could respond, "This situation requires medical advice based on your individual circumstances. I can provide general information, but for specific guidance on what you should do, I recommend consulting with a healthcare provider and offer to connect them with telehealth services or triage nurses." This puts appropriate boundaries on what AI provides while directing users toward actual medical advice from qualified humans. The challenge is that users often want advice, not information. Someone with symptoms wants to be told what to do, not given general information they then have to interpret and apply to themselves. This user expectation creates pressure for AI systems to cross the line into advice territory. Companies competing for users might make interfaces more advice-like to seem more helpful, even if it's less appropriate. This creates a race to the bottom in terms of appropriate boundaries. Regulation might be needed to establish standards that all systems must follow, preventing competitive pressure from undermining appropriate care. Educational efforts could help users understand the distinction and why it matters. Many people don't realize that appropriate medical advice requires individualized assessment, including physical examination. They may think that describing symptoms in detail to AI should be sufficient for personalized recommendations. Explaining why physical examination and diagnostic testing are often necessary and why remote symptom-based guidance has fundamental limitations could help users have more realistic expectations and use AI appropriately. The future might include AI systems explicitly designed to stay in the information space without crossing into advice. Interfaces could be structured to answer questions about health topics while systematically redirecting requests for personal medical advice toward human providers. For example, what could cause chest pain? Gets educational information. Should I worry about my chest pain? Gets both general information about when chest pain warrants concern and explicit guidance to consult a healthcare provider for individualized assessment. This consistent boundary setting helps users learn appropriate expectations while ensuring AI stays in its appropriate lane.